Hello and welcome to AXA Health Chats. My name is Eugene Farrell. I'm mental health lead at AXA Health. And today we're going to be delving into social anxiety, what it is, how it works for people, what are the signs and symptoms, and maybe some tips to help people with anxiety. Today I'm joined by one of my colleagues, Dr Imren Sturno, clinical psychologist at AXA. Imren's going to help me talk about this whole subject. Hi, Imren.
Hello, Eugene.
Now, anxiety is something we all experience, isn't it, in our everyday lives?
It is. It's a healthy part of our everyday life that keeps us safe. It's our brain keeping us safe. However, there are times when it becomes more problematic, when it gets in the way of doing your everyday life, where you may need more help.
There are lots of, I suppose, really simple examples of how we experience anxiety. I'm thinking about maybe a job interview. I can remember having job interviews and how anxious I felt. What are some other examples of general anxiety that we feel during our lives?
So we can experience it any time, really. And it could be ranging from doing your first talk, asking somebody out on their first date. All these things are anxiety provoking. It's a really natural way where our brain is trying to keep ourselves safe and trying to protect us from danger.
Okay. So anxiety is a normal reaction for us, and it's about our own safety. How does it manifest itself really in terms of the sort of signs and symptoms that we might have? What kind of general things will we feel?
Well, I think it ranges. So it's different for everybody, but generally speaking, we often get some negative thoughts about a situation. So we might build up a picture in our mind that it's going to go terribly wrong or be really difficult. Then we might have some bodily sensations where the heart rate might increase, or you may feel red and flustered. And also it affects our behaviour. So sometimes if we're worried about a situation, like doing a talk, we might avoid it, or we might start thinking really negatively about it and get ourselves really worked up. So they're classic signs and symptoms that we're feeling anxious.
I mean, I can think of sometimes when I've been really anxious about situations, you get that sort of feeling in your stomach, that kind of knottiness. And again, that's sort of a normal thing. But what about when it gets, I suppose, more worrisome for people, when it's starting to accelerate beyond that? What does that look like for people?
So it can range from mild, moderate and severe. And when it sort of goes more into that moderate realm, it's where we're starting to notice that it's affecting your everyday life. So if it's becoming that all you're thinking about is that event or a social situation or doing your talk or going to your interview where it's consuming you, and you're noticing that your physical, like you said, that knot and churning in your stomach is getting more. Some people feel sick, some people may feel panicked, and that's when we know it's becoming more of a problem.
So people can feel nausea, for example, when they're anxious.
Yeah.
But when it's getting more than that, when you're avoiding situations, avoiding doing things in your kind of normal life, that's when maybe it's starting to get a bit more of a problem.
Yeah, absolutely. And it's when it's getting in the way of your everyday life. That's what I always say. If something's getting in the way, then there's clearly something building there that's becoming problematic.
Before we explore a bit more about that, I just want to move to the point of, I guess, that kind of the bigger triggers where we get, I suppose, I might think about it as a panic attack. Would that be something that when it's a really big problem, maybe a bigger problem, and it creates this overwhelming feeling of anxiety? Can you describe what a panic attack is about and explain it a bit more?
Absolutely. So panic, we connect it to feeling that sense of doom and this imminent danger that you're in. So your body, your mind, your brain all focuses in on the fact that you're in danger. And suddenly you can't focus on anything else. And for some individuals, they get shortness of breath and they sort of literally hyperventilate. Others feel like they can't move and they get sort of immobile. So panic can be different for different people, interestingly. And often there's a belief that you're not going to survive the panic. And that fear is always driving that anxiety. So if you fear a situation and you're worried about it, and it gets bigger and bigger and bigger, your physical body is telling you there's danger because you're believing there's danger from the negative thoughts that it's provoking. And suddenly you're in that panic state. So panic is really common, and it's often quite difficult once you're in that state to come out of it because the build-up is so sort of stepwise and so problematic for the individual.
Yeah, so if you've ever seen somebody having a panic attack in that situation, it does take a while to get them. But certainly the situation that they're in, it's hard to resolve, isn't it? What is interesting, I think, about that is that it can sometimes happen even when you're thinking about a subject or a situation and you're not even there. Is that?
Absolutely. And it's the worry that's driving it. So it's those negative thoughts that we all have negative thoughts, and they're very natural. It's part of our everyday. I think we have And the, research has shown us that there's 45 thoughts a minute that we have, and 80% of those are negative. So they're called automatic negative thoughts. However, when it comes to panic, because you may have had one bad experience, that thought is there planted. Right. And if anything goes wrong, suddenly it's triggered. And then you're in a panic state.
So that brings it to the fore again.
Absolutely.
Based on your previous experience that maybe you exaggerated or you thought about in a different way, and then that comes to the fore, then it starts to interfere with that situation.
Yeah, and it triggers it straight away. And that's why some people, like you say, can fall into that panic place very quickly, just because they may have the slight thought that something might not go well or something does go wrong. And it could be something that other people may think is small, like losing their keys or not being able to find the pen that they want to write with. And it can be different for everybody.
Okay. So before we go into a little bit more about thoughts, can you just tell us a little bit more about other negative automatic thoughts that we might experience?
Well, when it comes to anxiety specifically as well with negative thoughts, it might be that you won't survive the situation. It might be that you feel like everyone's looking at you or everyone's making a judgment about you. So these thoughts can range and they can be very powerful. What we often say from a therapy perspective is thoughts are not real. Right. They're not the truth. And that's what's really difficult, because we believe our thoughts because they pop into our mind. And often when we have a situation that's new or something's changing, as human beings, we don't like change. So we focus on those negative thoughts even more, and then they become bigger and bigger. So negative thoughts could be about ourselves. It could be about how others view us. It could be about the situation being uncontainable, and then we worry about it even more. So they do range a lot, but they do drive anxiety because they drive fear.
Well, it's interesting, isn't it, that our brain is so remarkably developed that something we're not actually in can seem real at the time, and those can drive those thoughts. Now, I was thinking also about how thoughts and feelings and behaviours are linked together. It's sometimes said that our thoughts become our behaviours. And I'm thinking about also how does that actually work? You know, what makes a thought become an actual behavior? And if we can maybe focus that on maybe social situations, how does the thought about a social situation become the behaviors that we see in social anxiety, for example?
So if we think about thoughts, feelings and behaviors and our bodily sensations, they all have a knock-on effect on each other. So it's like a domino effect, because if we think a certain way, we end up feeling a certain way, then we behave a certain way and we have a bodily reaction. So an example of this within social anxiety is if we're worried about going to a party and there's going to be lots of people there, you would have potentially a negative thought where you're thinking, they're all going to be judging me. I'm not wearing the right clothes. I'm not going to fit in. That's going to start making you feel a sense of panic potentially, or a sense of sadness that you're not good enough. Maybe that worry is building up more and more, and then it's going to affect how you behave. It might impact on you avoiding that situation.
Right. So not going to the party because you don't want to feel that way.
And then also physically, in terms of your physical body and how it feels, that knotting, churning is really common. Also feeling that tension in your chest, heart rate going up. So all these things are driving and having a knock-on effect on each. So thoughts, feelings, behaviours and physical health are all connected, and your physical bodily sensations, which is kind of the premise of cognitive behavioural therapy, which I know we'll talk about later on. But it's important to identify those early on because they are all connected.
So it's interesting, isn't it, how that previous experience, whether that was real or not real, really, in terms of but it's real in terms of how you experienced it, becomes another thought, which then links into how we feel and the emotions that we generate, which then can generate a particular set of behaviours. So that previous past becomes a reality now.
Absolutely. And that's what's so difficult, because it probably, for the individual experiencing it, felt real. But the reality when you're at a party, there's so many people there, probably nobody is looking at you, but you can't see it in that way because you're feeling so concerned and so worried, and that worry is driving it and the fear. And suddenly it becomes the truth because you either avoid or you maybe don't interact in a way that you would normally. So it is a different experience for you. And that's why that cycle is so difficult to break, because it becomes the truth for you.
And so those cycles then become automatic for people.
Exactly.
And the more automatic they become, the more that they can accelerate in lots of other situations. Is that how it can work?
Yeah, 100%. And often we see, and particularly in young children when they're in new situations, and even us as adults when we start a new job, those new experiences, suddenly they replay. And we feel like it's all going to be doom and gloom, when actually it probably isn't. But because we've had one negative experience, it has that domino effect on other experiences.
especially as you said earlier, where we're kind of biased towards more negative.
Yes, we are, definitely.
So the brain is amazing in the way it does lots of things, but it does have this odd bias towards negativity, which we all have.
Yeah, 100%, yeah.
But we do manage to get through that, I think, for most of the time. I want to talk a little bit about safety behavior.
Yes.
And how that links. Now, for me, I'll think about kind of basic safety behaviors that we've learned. So if I'm crossing the road, for example, I've learned, and I learned, as a very young boy, I learned that I had to look to the left and I had to look to the right and I had to look to the left again.
Yeah.
And that's just, then that becomes automatic. It's a safety behavior that protects me from. I just think of it in that way. But safety behaviors can sometimes become more kind of subtle avoidances, can't they? We're trying to be safe, but it becomes avoidant of certain situations. How does that work?
Well, the whole idea of a safety behavior and avoidance is that you're trying to protect yourself. So it's self-protection. In the short term, it does work because you're avoiding the situations that's causing you anxiety. So, for example, if it's a job interview and you go into it and you're really worried, the last minute you might avoid it. Well, you're not going to get the job, which is terrible. But equally, next time you go for another job, already it's amplified your experience of being negative. So we call them avoidant behaviours. They work short term because they keep us safe, because they stop that anxiety. But long term, you need to get a job eventually. So it sort of prevents you from moving forward in your life. And we always say in therapy, the longer you maintain your safety behaviours and avoid, particularly the avoidance, the harder it is to break that cycle, that anxiety cycle.
So they become self-fulfilling. You thank your avoidance because it didn't put you into that fear and that anxiety. And therefore, if I do that again, then I'm safe, I feel better, but actually I'm just avoiding the situation.
And we're not learning to overcome it. Right. And that's the key. So in life, there are lots of things that we do all avoid for different reasons. And the whole term safety behaviour is to keep you safe. And you want to be safe. You don't want to feel your heart pumping. You don't want to feel like everyone's going to judge you. You don't want to feel anxious. You don't want to feel worried all the time. However, if you keep doing this, it's really not going to help you with social anxiety. So short term it works, but long term, not the best sort of strategy.
So that's the brain again, because you're not actually unsafe. You're just uncomfortable.
And you believe you're unsafe. And that's the thing about the thoughts again, and the belief. So it comes right back to those negative thoughts because we believe our thoughts, even though they're not necessarily true.
And I want to talk about anxiety today.
Okay.
So when I look at the ONS, Office for National Statistics figures, and I started tracking this since COVID and before COVID.
Right.
And if we look at the well-being measures, for example, for anxiety, the anxiety level is still above pre-COVID levels. So in our world, as we are now, there's lots of things happening, and we kind of haven't settled back into the pre-COVID world and anxiety level. So I guess what I'm saying is there's a lot of it around, surrounding us all the time. But COVID did something different, I think, to people in anxiety. There's some different experiences. So let's explore some of those. And some of them are social and some of them are other situations. So, for example, if I'm a vulnerable person from a health perspective, I might be much more anxious about going on public transport.
Absolutely, especially in the context of COVID and since COVID. And we often see any individuals with any sorts of vulnerability, whether it be the physical health vulnerability or whether, even all of us as social beings, suddenly the world changed overnight for us. And we all became quite vulnerable in the sense that change was so dramatic, depending on your living situation, who you live with in your home, depending on who you spoke to, who you had contact with. So I think COVID, as you said rightfully, socially has had an impact on us and how we behave, but also fundamentally on how we understand our world and how we make sense of it and how we experience it.
Right. So that big shift happened. So for people who, and I see this a lot with organizations that I work with, so people who are hybrid working or remote working, there's almost sometimes a resistance to going back to the office, maybe because they're more comfortable working at home. And
Sure.
But for some people, there's a real anxiety about returning to the office. Do you think?
Absolutely. And individuals that I work with as well, we've come across this a lot more recently, because the environment has changed a lot of work. So you might be hot desking now, for example, so you don't know who's going to be in the office. You might not see anybody might be new individuals. Lots of individuals worry about what they're going to wear all of a sudden because everything's more relaxed. Will they fit in? Are they going to be able to engage the way they used to? What if their normal colleagues aren't there? So all these worries you can see start building up in individuals, and it can be quite difficult because it's another different way of working because it's not gone back to how it was before. And I think that drives it a lot as well, because the fear of not knowing what to expect can be really difficult for individuals that struggle with anxiety.
And if you're a younger person whose first job, experience of work has been remote, maybe it's possible that you haven't managed to build up those kind of behaviours, that kind of confidence in yourself, those normal interactions that we had, in the world before COVID. And we're kind of just losing a bit of that practice, maybe, and a bit of that experience. Do you think that could be happening? That's what I think.
Yeah, absolutely. And I think we see a lot clinically as well when it becomes a much bigger problem in therapy, where we have young individuals who are really keen, had COVID during university time as well, and they really want to make their way in the world. But the landscape has changed, and actually that professional tone or that professional interaction and how to be professional, these are things that we learn. These are our soft skills, our social skills. And suddenly, if you're going into an office where none of your team are in that day, because you're hybrid working, it's quite hard for you to know how to connect, what is appropriate, who to ask. All these questions build up, and it'd be really anxiety provoking. So I think because it's changed so much since COVID, how we navigate our social world does lend itself really well to anxiety, unfortunately.
Right. So there's this kind of, what I think about as a kind of social awkwardness. But I guess that we might think about it as a continuum, really, in anxiety, that at one level, somebody's feeling socially awkward, I'm not used to this, but at another level, on that continuum, somebody's feeling those things that we talked about earlier, which is that real, intense anxiety about a situation. Do you think I'm right?
Yeah, absolutely. And I think you're right. And it's a good way to think about it, like a continuum where you've got the more mild anxiety. And it's not to say that that isn't significantly important for that individual and they're not suffering, but then it could sort of go all the way down to the other end where actually it's becoming the negative thoughts are flooding you. You can't really get out to go into the office because you're so worried, and it's becoming a real problem. And what's really difficult about anxiety is if, as we said before, the more you avoid, the bigger the problem becomes. So that continuum is a good way to think about it, because you might dance around a bit. You might get, milder times when it's easier,
right,
and then times when it's much harder, depending on what's going on in your world.
So we're not always in one place on that line, on that continuum. We can move up or down, maybe through life stages.
Absolutely. And I think through what we call those significant life events, clinically, and it's the life stages where we've got new things to achieve or big changes happening. It might be going for your first driving test. It might be getting married. It might be going for your first promotion even, or doing a talk in front of lots of individuals that you haven't done that before. Because obviously during COVID, a lot of us worked remotely through Teams or different ways. All of a sudden you're in an office with 100 people and you're going to do a talk. So your anxiety might be increased at that point, whereas, during the rest of the week when you're working from home, it might be much lower. So anxiety does exist on a continuum. However, when it becomes a clinical problem, which I know we're going to talk about a bit later on, and when we diagnose anxiety disorders, that's when it can be impacting on every aspect of your life.
And is it true to say that our past experience of managing anxieties are not necessarily a predictor of how we're going to manage them tomorrow or next week or next month or next year?
Yeah, absolutely. What's really difficult, I guess, with anxiety is sometimes one strategy that you use works really well, but suddenly if your anxiety increases a lot, or say it's more around how you're physically feeling, say the problem you have suddenly isn't just the thoughts, but it's that you're getting red and flustered and you feel like people are going to be judging you even more, those strategies might not be working for you. So it changes, and your needs change of what works.
So we might need to think about the things that we've done before that worked, but change it up to something else.
Exactly, because they do have a bit of a shelf life, and that is difficult, which is why we always say we need to flood individuals with lots of different strategies for how to help themselves, because one size doesn't fit all, and you might need something different depending on the situation.
Okay, so we're going to explore some of those strategies in just a while to give some examples. And I think that idea that what works for me may not work for you.
Yes.
And what works for me today may not work tomorrow. Okay.
Absolutely.
No, they probably wouldn't change that quickly.
No, but I agree. I think there are times in our lives where certain things work really well. And then if we revisit it suddenly, we're thinking, well, why doesn't it work? And that's why it's really good to have like a toolkit. We talk about a lot of strategies that you can draw on when you need different things.
Okay, we're going to get to that.
We will.
We're going to open that toolbox in just a moment. So let's think about when should we get some help? What does that look like? When would you say, I think this person needs to get some help?
So if we're thinking about a partner, for example, if you know their everyday habits and suddenly you're noticing they're being more avoidant, they're talking more about negatively about themselves, about their performance, maybe at work, or about not wanting to be around their friends, their family. Generally, clinically, when we talk about getting help professionally, so either going to a therapist or even your GP is a first step, it's when it's interfering with your everyday life, when you can't function as you choose to because anxiety is getting in the way.
So it's when you're not enjoying your life as you used
Absolutely.
to. This thing, in terms of our social anxiety, getting in the way, preventing us from doing things that we may have enjoyed in the past. Yep. Okay. Or when it's overwhelming to people.
Yeah, overwhelming is a really good way to describe it because it can become all-consuming as well. So it might be, we see a lot with young people who, for example, are termed as school refusers at the moment who don't want to go back to school, but it's because there's a lot of anxiety about going back to school since COVID. Right. Some might have had physical health problems that's driving that vulnerability as well and making them feel more anxious. So I think consuming, overwhelming, stopping you engaging in the world as you would normally, and when others around you are noticing that you're actually not your happy, normal self, you're not engaging in the way that you always did, that's when it does become a problem. And the more individuals avoid, that's something to look out for. Avoidance is key. If you're noticing someone you care about is avoiding social situations or avoiding everyday life, something's going on.
Okay. We'll get on to some of the professional help in just a moment. Let's talk about maybe some of the simpler things, the kind of self-help things that somebody might think about. So I'm thinking about triggers. So maybe understanding what kind of triggers you have, what makes your anxiety grow, or what triggers anxiety for you. Is that one we could start with?
Absolutely. It's a great place to start. And I think for many, anxiety can be quite private. It's quite a private thing that this is what I'm thinking, this is what I'm feeling. And if you never talked about it with anybody, even just talking with somebody for the first time might feel such a relief because it's not this secret anymore. You're getting it out of you.
Right. So, and actually, if we've never really thought about, this is giving me an anxiety feeling, then we've never addressed it, let alone talk about it.
Yeah.
So a bit of looking at ourselves can be really helpful. What about, if we're thinking about social anxiety, maybe doing it bit by bit, sort of moving forward and breaking it down into small chunks rather than, launching myself into a great big party with 200.
Flooding yourself with it. Yeah, absolutely.
That might work for some.
It might. But there are, so different things work for different individuals, as we've said. And I think you're right. I think sort of breaking it down, the key really to anything, I think, and overcoming any difficulties we have is understanding it. If we understand what's driving it, if we feel that we can just take 5 minutes to just think about actually what's going on for me, what's happening, why am I feeling this way, what's driving it? These are hard things, but you don't have to do it on your own, as we've said. Once you understand it, then you can start addressing it. And breaking it down is beautiful because maybe you might go out with 4 friends to start with rather than going to a party with 100 people and building. It's about building back your self-esteem, your confidence, your networks, trying different things socially. And it's just about getting out there again and not avoiding. So if you're doing that, you're on the right steps.
I've got a couple of things that I might think about. One is get there early.
Yep.
Well, firstly, you're not going to have the anxiety of being late.
Absolutely. If that's what drives it.
I don't like that piece. But getting there early means perhaps maybe you're only meeting one, each person as they arrive, and you're kind of reducing that big feeling into smaller bits, rather than walking into a room with 100 people where you think everybody's looking at you and you feel awkward about it. So that's one of my kind of things. That I think about. Another one might be, I was going to say rehearse, but I don't quite mean it like that. If you feel socially awkward, you're feeling an anxiety, maybe having some subjects that you can talk about.
Yes, preparation is key, Eugene. Here, you're absolutely right. So having some topics ready, because if you feel like you're going to clam up and you don't know what to say, having those topics ready is a great way of breaking the ice, and then it flows, and naturally conversation will flow. And there are always situations where you'll find somebody that wants to talk to you. There always are.
Maybe some of the softer things happening.
Sure. Or if a new film's come out recently or something,
That's a great one,
something like that, or music. Again, it's about having that conversation that you would normally have, that, small talk.
So you've got a few little things that you've prepared, and you could rehearse how you're going to talk about those. That might be a useful way of kind of breaking across that, making that first step towards, dealing with that anxiety. What about, the idea, if you are confronted with a group of people, and I know it can feel awkward when you walk up to a group of people and they're having a conversation, but that's okay, isn't it? We can just listen in and then maybe ask a question like, so you were talking about, and then join in with that conversation or just contribute to that conversation. That works.
Absolutely. I think for some individuals, even being in a room with lots of others and even being silent is a massive step for them. So we've got to remember breaking it down for what you can cope with, because we want you to be successful when you try these things, rather than because we want to reset the brain to believe that you're safe, not unsafe. And that's the key. So if it's just being in a room with lots of others where you're tolerating it even for 10, 15, 20 minutes each time, longer and longer, amazing, because you're making those small changes to building your confidence.
So the skills also of open questions, which not everybody will know. That's a question that doesn't have a yes, no answer.
Absolutely.
Right?
Yeah.
So that can open up conversation. So learning, you can just look these up. If you Google open questions, then you can see what open questions look like. And then you're able to use those in conversation, maybe. I'm also a big believer in the kind of body and body position. So if you feel, I was going to say powerful, maybe that's not quite the right
stance, though, isn't it? There's something about your stance and how you hold yourself.
Yes.
And we normally
see how I puffed myself up
that's
there.
what I mean. Yeah, but it's interesting, isn't it, how we associate being confident with that stance. But I think it's more about not shying away into yourself. Right. That's the key.
Not being closed up, but being much more open.
Yeah. But often what we say is be yourself. Just try and open yourself up a little bit, because if you're closed in, you're likely to feel a bit closed as well, and you're sort of self-protecting again. So it's around small steps, manageable steps that work for you.
Okay. Another one that I was thinking about is, I suppose, owning the situation, sort of naming the feelings and actually just identifying that what I'm feeling now is this anxiety. What it's doing is protecting me in some way, like you were talking about earlier.
Yes, you're taking the power away, which is a really important part of you overcoming it. Because if it holds all the power, if you believe all these negative thoughts about yourself, about the fact that if you go into this situation, you're not going to survive, you're not going to cope, it holds a lot of power. Whereas if you tell yourself, hold on, I know that this is my anxiety. I know that I get triggered. I know that I worry about what other people are thinking of me. I'm going to accept that that's what it is. And I'm going to break it down and try some small things today, just some small things, to see if I can overcome it. Because then you're resetting your brain and you're trying to help your brain understand that it's healthy and natural to be anxious and to protect yourself, but that it doesn't need to control you. So lots of evidence and research has told us that cognitive behavioral therapy, CBT, and many of you have probably heard of CBT, is the gold standard treatment for anxiety disorders. What CBT does and what it looks like is very similar to what we talked about before. So it focuses on the here and now, so what you're experiencing now, your thoughts, your feelings, your behaviours, your physical body.
And those drive the behaviours. All
exactly.
That stuff, right?
CBT is excellent because it can be long-term or short-term, but it helps challenge your negative thoughts, and it teaches you skills around how to manage that anxiety, which many individuals need. So you're walking alongside that with your therapist, which can be really helpful.
I like that idea of walking alongside.
Yeah.
It's not something that's done to you.
No, not at all.
With you. What about in the workplace? So if you were in a workplace, that there might be a counselling program there or something.
Yeah, there's lots of different programs out there. There's the EAP, which is the Employee Assistance Program.
Okay, what's that about?
So some individuals may have that with their employer. So lots of the corporate companies that I work with currently have that as well, where you have a telephone number where if you're struggling with any of your mental health, whether it be mild or moderate or even severe and anxiety, and you feel like it's getting in the way, it's becoming a problem, you can call the helpline and they'll arrange for an assessment. And what we mean by an assessment is somebody who is trained in counselling or therapy to talk through with you what your problems are at a time that's convenient for you and helps you understand what your needs are. And it can be really useful. If you don't have that, the GP is a great place to go. Also, for those that listen with young children, if they're worried about anxiety, again, first port of call is the GP to help unpick some of these things and think about what the needs are for your loved one.
I was also reading about some of the more obscure things, but when I looked at these, maybe they're not so obscure. So cold showers came up. I was reading about. So that seemed like an odd idea to me with anxiety, cold showers, but it's not, is it?
The premise of this comes from a type of therapy called dialectic behavioural therapy, DBT, and it's used to treat many disorders, but it's called the dive reflex. So what it's based on is, and when divers go deep sea diving, obviously temperatures are really cold, and there's been lots of research done on what happens to the brain and the body. And because the brain is so focused on keeping you warm and not, going to a panic state, your body is freezing, it switches off the emotional part of the brain.
Right. So there's real science.
There is. Now, you may be asking yourself, how can you have a cold shower during the day if you're at work, for example, and feeling anxious, or if you're at school and feeling anxious?
Kind of tricky.
Yeah, so probably not a good idea, but you can recreate it. So a really good way is to get your wrists under a cold tap in the bathroom. Just leave them under the cold tap. It might sound strange and bizarre, but it does help some people really calm down with their anxiety.
That's a really great one.
There's a whole sort of movement in research looking at positive thoughts and how we can embed more positive thoughts in us, because we have so many automatic negative thoughts. So I think the way it normally works is when we're thinking about happy times or happy memories or looking at funny things on YouTube, it's because we're using it as a distraction. But actually, if we're laughing, if we're watching more comedy, for example, you're feeling better. You're feeling good about yourself. And you may go to a comedy event.
Positive mood stuff.
Exactly. Yeah. So there's a lot of evidence on that. Now, again, it depends what you feel works for you, but it's worth trying these things.
Yeah, I'm sure it would.
So if you get a formal diagnosis of an anxiety disorder, and there's a cluster of disorders that come into anxiety. So it could be social anxiety, it could be generalized anxiety disorder, GAD, PTSD falls into that framework, even obsessive compulsive disorder, OCD.
So those are all the different types of anxieties, because there isn't just one. Everyone thinks it's just one anxiety.
No, not at all. And health anxiety is another huge, since COVID, we've seen a massive increase of individuals going to the GP with health anxiety. With all of those, if you get a formal diagnosis, you would have probably seen a clinical psychologist or a psychiatrist. Yeah. And then the psychiatrist can prescribe some medication. But again, it must be done by a psychiatrist or somebody who's medically qualified, and they would explain it to you fully about why it would help you. And often you are given medication alongside therapy.
Okay, good. So for me, my kind of first go-to thing is about breathing.
Okay.
So I like the kind of focused in breathing, and I would often use this technique of holding.
Let's do it together.
Yeah. Mm-hmm. Just holding your belly so you can feel that, but also holding your chest. Mm-hmm. And what we learn to do is to take a breath into our belly and not into our chest. So I kind of start with just normal breathing. We feel how our chest goes in and out. If we breathe in, just stop very slightly, and then breathe out slightly longer than we breathed in. Mm-hmm. But actually then we revert to breathing into our belly.
Okay.
And it changes the way that we breathe. And what we're doing is bringing our focus into that. I'm not saying that in the moment you stop.
No. Absolutely.
But if we learn the technique, actually no one will know that you're doing a breathing technique. And that, I find that really helpful. Mm-hmm. That for me calms my mind down an awful lot. And I think that's something I recommend to other people. But you've got another breathing technique that uses your hand.
Yes, so it's called hand breathing. It's something that works particularly well with young children. So if you, so I'm right-handed, so use the hand that's your dominant hand. So I'm right-handed. So if you raise your left hand, the technique's really straightforward. So you start at the bottom here, in your wrist where your thumb is, and you breathe in as you go up through your nose. And then as you go round your thumb, you exhale through your mouth. And you repeat it again. So breathe in and out. And what
really focuses you in.
And what we encourage young people to do is to look at their fingers, feel the sensation. So you're really homing in on your hands, your breathing, and you're trying to zone out from everything else. So you go all the way.
And you get a cycle of 5.
Absolutely. And then if you're still feeling really anxious, you go back. So it gives you a technique. And what I'd say with all these breathing techniques is you have to practice them. Yeah. So anything around mindfulness, because it's part of mindfulness, anything around breathing, if you do it every day for a couple of minutes, that's all, it'll become easier for you and your natural kind of go-to, because we need these things to come to us readily, don't we?
Yeah. I remember when I first started learning to kind of breathwork stuff, that I couldn't calm my mind, but it actually, when you learn the technique of focus, then the mind starts to calm, and that can become really powerful. Works for me, might not work for other people.
Well, absolutely. Another way of thinking about it is like we have our 5 a day with our fruit and veg. I always think that I have this dream and belief that practicing these things will be part of our everyday as well. And if we can get into good habits from now, I think it's brilliant, because there are times in lives when we will have difficulties. There are times in lives when mental health may be more dominant. So if we're getting really skilled at using all these techniques to help us through, I think it's brilliant.
Okay, there's another one that we want to learn today called STOP with 2 Ps.
Stop with 2 Ps, that's right.
Let's go through that.
Okay, so if you're starting to feel anxious, or you know there's a situation that is going to be anxiety provoking, the STOP technique is a great one. And if you look on the Mind website or Get Self-Help, there's a lovely PDF of it as well. So you need to, S stands for stop.
Oh, right. Okay.
Okay, take a moment. T, take a breath.
So breath again.
Exactly.
We can use our technique of breathing through the belly.
Perfect.
Pause a while, breathe out.
And just do that for a few minutes. Just stop, breathe. So stop, STO, is observe. What's happening? What's happening to my body? Well, what am I thinking? Just some basic questions around, what are my beliefs? What's going on?
So explore the moment that you're experiencing that thing. Right?
Absolutely. Then the first P, so we're doing with 2 Ps, is pull back.
Okay.
So by that, we mean take yourself out of that situation for a moment.
Physically or
in your mind?
Okay, so it's not walking backwards.
No, I mean, you could, but I don't know how beneficial it will be.
Okay.
So it's pulling back from it all, because suddenly you're getting into a state of overwhelm, which is why we've said, stop, take a breath, observe what's going on. Just pull yourself back for a moment.
Psychologically pull back from there. We're sort of bringing our attention back.
Exactly. And what you can then do is breathe again. So breath work is really important at that point, because what we hope to do is then the second P is practice what works, which is why it's so important to identify what works for you.
Okay. So use one of your techniques.
Yes.
That's going to work for you. So stop, STO.
PP.
Okay. That's a great one. Now there's a distraction activity that I like. And I can never remember how this works. It's called 5 things.
Okay, yes. So there's different ways of doing this. And the way I was taught is thinking about your senses. So you have to really focus your mind, which is the point of the distraction. Yeah. And it's also a bit mindful as well, because you're looking at what's going on in your environment. Okay. So we can talk through it. So 5 things you can see. So if we list it, I can see you in front of me.
So we look around and identify 5 things.
And list it. So go around the room and do it with us, everybody.
So I've immediately taken my attention away from...
Well, you've already looked around.
Yeah. Okay.
Beautiful. So 5 things you can see.
Yeah.
4 things you can touch.
So that's another sense.
So you have to move, touch, feel your bottom in your seat, feet in your shoes. So that's another sense. We've done sight, we've done touch.
Yeah.
3 things you can hear.
Okay.
So you have to take a moment, really concentrate, and that's a really good one.
So you might hear the traffic, some people talking.
The clock ticking, yeah.
Yeah, okay.
2 things you can smell.
That's a more tricky one, isn't it? Because you really got to focus to get that right.
Very much. So it might be the perfume you put on in the morning, or it might be, even if you're on the tube and you're getting anxious, it might be someone's aftershave you can smell. It could be anything. It could be the newspaper that they're reading, So really focus you in on other things. That's the key.
Okay.
And number 1, the last one, is what you can taste. Now, taste is an interesting one as well, because when do we think about what we're tasting other than when we're eating?
And it's interesting in terms of anxiety. So that's a link there. That's really fascinating.
And something that we encourage individuals to do if they are socially anxious is to have some boiled sweets or some polos or mints in their pocket. So when they get to the taste, they'll take out a mint. And again, it's another distraction because they have to remember where they put it. And so it's all these things that we encourage because it does take you away from your attention of the anxiety and the negative thoughts. And another one that's great for this is A to Zs. And I do this a lot with a lot of the young people I work with. A to Z of countries, A to Z of food, A to Z of your favorite groups. Because again, it's something that you're talking about and it's completely different to the anxiety. So you're distracting your mind. Now, journaling can mean different things for different people. So if you think of traditionally journaling, this is it. So it could be if you really enjoy writing about what happened in your day and how you felt, fantastic, go for it. But for some individuals, it's about just getting out of them. It's getting that thoughts, feelings out of them on a piece of paper. They might not even look at it again. It might, or others may do it twice a week and then they review what happened. What we encourage from a therapeutic perspective is if you're going to write a journal around anxiety, particularly to help you overcome it, focus in on what your thoughts were, what you were feeling, what your behaviours were, and what the situation was. And then you can revisit it and see what you can do differently.
So that you can understand your triggers.
Exactly.
Or what certain situations make you feel much more anxious than others.
And then you can map it as well. So I'm not saying do it every day, because that's a big commitment. And these things need to be realistic. There's no point us saying, oh, do this, every evening. It's not going to happen. If you do it twice a week, see how you go with it. Try it.
So we've covered quite a lot on that.
Mm-hmm.
I just want to revisit just as a conclusion and summarize the whole thing. So anxiety is something we all experience. And so if we feel that it's getting in the way of our everyday life, we should seek some professional help. There are also those self-help techniques that we talked about for social situations, like arriving early or rehearsing or looking at some subjects you can talk about. Those things might be posture.
Absolutely. Posture, breaking it down as well, even just standing in the room as a first step. Absolutely.
Yeah. And then there are the techniques that we talked about just at the end that you can do in the moment. So the 2 different breathing techniques.
Yeah.
So learning to breathe through our belly or using I like this one.
Finger breathing. Yeah.
Finger breathing. The stop technique that we talked about, using our senses to distract the 5 things. Imren, thank you for all of your insight, bringing the therapy room into our conversation today, and your expertise in describing lots of things. I hope that this discussion today is going to be really useful to people. And I hope that we can come back and talk about another subject in the future.
Yeah, thank you so much, Eugene. I really enjoyed it and I'm delighted to help. So I hope so too. Thank you.
Thanks.